Let's start a busy day. We have 8 surgeries lined up, spays and neuters for both dogs and cats, all to be completed in just a couple of hours. Time to get to work. For every spay surgery, I begin by thoroughly examining the patient and reviewing any pre-op blood work. Once anesthesia is safely induced, I shave and sterilize the surgical area. I make a midline incision just below the umbilicus and gently access the reproductive organs. I ligate the ovarian pedicles using absorbable sutures or other appropriate surgical techniques to ensure there's no bleeding. I also ligate and remove the uterine body. By removing both the ovaries and the uterus, I ensure the patient won't experience future pregnancies or heat cycles. I close the abdominal wall, subcutaneous tissue, and skin in multiple layers, using sutures and surgical staples to ensure secure healing. I've successfully completed 3 spay surgeries on dogs. Now, I'm moving on to 2 neuter surgeries. This patient will undergo the same pre-operative evaluation as the previous ones, including blood tests if needed. I make a single incision just in front of the scrotum for dogs, or directly over each testicle for cats. Then, I carefully exteriorize the testicles and isolate the spermatic cord. I ligate the spermatic cord using absorbable sutures to ensure proper bleeding control. I excise the testicles, then carefully inspect the cord for hemostasis before returning it to the surgical site. I close the surgical site with sutures or staples, depending on what's most appropriate for the patient. With the 5th surgery successfully completed, we now move on to our feline patients. 3 cat spay surgeries are ahead of us. Now, I'm performing a routine spay surgery on a cat. The approach is similar to the canine procedure, but with slight adjustments based on the anatomy and size. Everything is proceeding smoothly. The uterus and ovaries have been successfully removed. Now I'm closing the incision in layers, and she'll soon be in recovery, carefully monitored until she's fully awake. Today, we had a total of 15 surgical procedures scheduled. We started the first surgery at 10:20 a.m., and it's now 12:15 p.m. We've completed 8 of those cases so far. We filmed portions of today's work to give you an inside look at what a typical surgical day in our clinic looks like. Each patient is treated with full attention to safety, hygiene, and comfort. The rest of the surgeries will continue this afternoon as planned.